described as floridly schizophrenic.
I think that what that brings out is that in our society we are so focused on blame, and I think we are in danger of losing our compassion. And so that headline that you've described is void of compassion and is intent on blaming someone. And I think that is something that's most unfortunate. I also think that probably it's time for me to come out on this panel. I did direct the film, but my day job is a district court judge, and I do hearings in mental health hospitals, and I think of Section 18 of the Mental Health Act, which when the hospital's applying for an inpatient order or a community treatment order, the first thing the judge has got to do is introduce him or herself and examine the patient. And I've always stayed away from that wording, talking about wording, because I always think, if I were to say to someone, I'm going to examine you now, I'd be a little worried as to what they might think and whether they would start unbuttoning their shirt. And the language of the Act is peculiarly unhelpful. A responsible clinician is a doctor. I mean, why can't we call them that? And I think we do get jargon laden, and I often read reports full of terms that I have no idea what they mean, and I ask. And I'm a firm believer in plain speech and decision making too. But I think we are laden in our society with jargon which is meaningless for consumers, meaningless for judges too.
Because I'm a writer, language is supremely important to me, because language actually creates things, and the irresponsible use of language is terrible. The power of language is sometimes underestimated in shaping opinions. However, what I wanted to say was in response to Marion's sort of opening thing about this within the mental health sector. I'm kind of interested because the sort of verbal nations that people use within the mental health sector are amazing, really, and trying to avoid sort of describing anything. And I would call people back, I think, to what's happened with a number of groups that have been stigmatised. I mean, at one time it was bad to call someone black until black people said, we are black and we want the word back. Same, gay people sort of reclaimed the word queer, which has been used as an abusive term. And I think sometimes it's good to be robust with your language. When I was sort of vaguely associated with people who would be now described as having lived experience of mental health, they were psych patients, and they called themselves psych patients, and that's what they were. And in some ways I felt it sort of stripped away their identity, but when we sort of got a bit PC. So, anyway, that's my
okay, so just about language. One thing that's very difficult to do is to change the language people use. And as a nurse working in the mental health sector, we're subject to a lot of kind of reframing, if you like, through language from various sources. And I guess we try and be aware of when a term might have passed its use-by date. And I would give the example of patient as one of those terms, which for some people, they decided this is a term that no longer describes us because it puts us in this kind of medicalised position, and that's not the position that we want to be in. So as a health professional, we're kind of always trying to look at how we position ourselves in relation to language, and that changes. There's no term that we can just sort of say, this is the right one, and we'll use that forevermore. I'll just give you one example, though. In my teaching of mental health nurses, one of the courses that I teach is an assessment. Now, I don't have a great deal of faith in my ability to actually teach nurses much about that, as much as I try. But one of the things I say to them is that sometimes in the mental health system, there's not a lot we can do to change the things that we see that we don't like or agree with. As one individual, we can advocate, we can talk, we can raise issues, but we can't necessarily change things. But one thing we can change is the language we use, and the example that I use in this regard is the word schizophrenic, or the term schizophrenic derived from schizophrenia. I put it to the students that the term schizophrenic is a label, when it's used in that way, that constructs the person's identity as if there is no other aspect to them apart from that mental illness, which they may or may not agree that they have. And so I encourage students to talk about people with, and then think of how they're going to describe those people, but try to avoid using diagnostic labels as labels about people. Now, it may be something of a fool's errand in the sense that I don't know if people take any notice of me when I say that. It's something that I certainly do myself in the way that I use language in my teaching and writing. But I think it pays us, and I'm talking about health professionals here, to be very aware that the language that we use might depict, portray, or construct people in ways that they don't find particularly helpful. So that's just my little comment about that. Cheers.
Yeah, so I guess what can't be disputed is that words do have power, and it all depends on the intention behind the words. So whenever you hear the expression of sticks and stones, make me brave my bones, but words will never hurt me, I just think it's just a load of rubbish. When I think about the different labels that we use in mental health services, so we have consumer, we have client, we have patient, we have tangata whai ora, so that's 4, plus all the other labels that people tend to give each other, plus the labels that family members then give them. I mean, that's a whole lot of labels. So from my perspective, I feel a bit torn, because I think sometimes when people access a service, to be given a diagnosis or a label can be quite comforting, because finally they have something that they can then attach something to try to find meaning. But yet, on the other hand, that label can then be detrimental because of the way that it's seen in society. So as another example, take that the movie with Batman, for example. He refers to Joker and he refers to Two-Face as being schizophrenic. But they're not schizophrenic, actually. They're nothing to do with schizophrenia. Completely different medical condition that they have. Just following up from my colleague here, as a lecturer in social work, I did the complete opposite, as my students will say, because I can see some of them, and would actually encourage them to make changes, and that I think that it is possible from a social work lens, not sure about a nursing lens, but from a social work lens, that it is possible to create changes. And as a very quick example, as someone who's worked at both acute mental health as well as in the community, people used to have a habit of saying that this is my schizophrenic client, whatever, right? But as a counsellor, first and foremost, they're a person first. So they're not, I hope no one's not called John in here, but you know, they might say, this is my schizophrenic patient, John. Whereas from my perspective, they're John first and foremost, who just happens to have schizophrenia.